Good morning, UTMB. How are you guys doing? Everybody okay? You ready for a great holiday season? All right, I think we all are. We're going to play this better than even the Texans played this week, okay? And you have to understand, New England is my favorite team, so that was a heartbreaker for me. I'm sorry. Now you know my most secrets. I just think New England is a terrific team, but the Texans certainly put that together, didn't they? Well, we got a great team here with all of you today, and I want to start off today by first of all letting you know I'm still here, so the search is not over yet. So they'll still be addressing that over the next few months. We have a Way to Go award to start today, and I want to first of all ask Terry Tullis to come up. Did any of y'all know Terry? Well, Terry is a real special person who has worked at UTMB for a long time, and her work has touched many, many people's lives. And we have some of those people today here. Now, you don't have to cry yet, okay, because the crying part isn't over. It's just getting started. I have a letter I want to read, and this letter, you know this person really well. It's from Sonia Acosta. And Sonia wrote, "Hi there, Terry. Not sure if you remember me, but I certainly remember you. We missed you at the pre-me reunion. We were hoping to get to see you. Our son, Alejandro, was in the NICU many moons ago, and he's now 17 years old. Alejandro, would you come up?" Sonia and Francisco, come up. I want Alejandro's parents also up here today, Sonia and Alejandro Acosta. Now this is Sonia's words to Terry. He's big and healthy. Do you think that's true? Yeah, he is. And just like you used to tell us, he would be. I have thought of you and your encouraging words through the years, but more so now as it comes to graduation and never before. You made a difference. You helped me in so many ways. Our son knows you by name because of the impact you made on me and us in our family. One of the most vulnerable times in our lives. I'm sending you these pictures just so you'll know and be able to put a face to the name. I'm hoping to be able to take Alejandro on a tour of the NICU with Yesenia's help, and maybe we can have a quick visit with you. So you can still get by there, but we wanted you to have a visit today. And there's a whole team of people that's responsible for Alejandro. There's a group of prenatal folks who start out in providing that care, right? And there's an incredible group of people, and I want to ask Dr. Joan Richardson and Dr. Fonseca to also come up here, since they represent these individuals represent the University of Texas Medical Branch's neonatology unit, and the absolute wonderful work that goes on there. The hands of many people: respiratory therapy, clinical laboratory science, radiology, nursing, doctors, social workers, an endless array of individuals, particularly in the area of rehabilitation. All of those people are part of that team. And we're here today to celebrate two people, really. We're here to celebrate the incredible work that you have done that symbolizes all UTMB employees. And we're here also to celebrate Alejandro, because Alejandro is living proof that working together does work wonders. And in that, we're going to start with a t-shirt for you that recognizes you for your incredible work. But we've got something else for you guys to do, so you have to move over here. We're not trying to start a tradition here, but we want everybody to get a little festive. So Joan, for you, you have your own. Okay. And you see all this stuff back here? This is Santa's grab bag. You see all those people? I don't want many people to go home empty-handed. So why don't you, Alejandro, you want to throw out the first shirt? You can take one of the blue ones up there. You can keep one for yourself, too. And remember, I've already told you, these are all the same size, so just throw it as far as you can. Throw it. All right, look at that. There you go. Throw those. You can easily walk down the aisle, so I'm going to just be talking. Help them pass out some shirts. We're not trying to get you in a football spirit, but after all, it is the holidays, so enjoy, guys. And those of you, all of you are part of the UTMB team, so here you go. I have a couple of other people I want to congratulate today. In League City and Clear Lake, the faculty and staff there went through their first joint commission review and did so with extraordinary scores and findings. So I'm going to ask a couple of people to stand up. Dr. Tim Hardin, would you please stand? Katrina Lambert, take a bow. If you had anything to do with the Joint Commission, anything at all, your fingerprints are on that, in those two hospitals, please stand. Thank y'all so much for once again making UTMB an outstanding place for patient care. We have one other award also, and Rex, I know you and Ann O'Connell are here. I'm not sure Dr. Judice is here or any of her staff, but the NCQA recognition of medical home for all of our clinics is an incredible accomplishment. If you work in any of the community-based clinics or any of the campus-based clinics, please stand up and take your accolades. All right. We have some quick business to take care of today, so I am one of those people who likes to get down to earth real quick, so I'm going to start with merit pay. I know that some of you did receive your merit pay. Most of you should have. Let me just begin by saying a couple things pretty directly. I understand there is some dissatisfaction with the way merit pay was awarded this year. And that dissatisfaction primarily comes from some issues related to how individuals were scored. This is completely a decision at the management level. You're direct manager over your area. And so if you feel that you are not treated appropriately in your merit pay decision making, what you need to do is schedule a time to visit with your manager. And if you'll look at your worksheet that you completed, there's an area for you to respond on your HR forms. And you should say why you disagree with your manager's decision for awarding that merit pay. And if necessarily, file with your manager a grievance that says, look, I disagree with you, and tell me why. You deserve to know why you did not get what you thought you deserved. Now, your manager, at worst, is going to have a conversation with you, I hope. If not, that's another issue that we'll take up. But you and your manager may need to get on the same page about what their expectations are from you and what your expectations are in the future. So it's a conversation. At least you need to know why you did not get what you thought you deserved and why your manager feels that's an issue. Hopefully that conversation should have been going on all year, but evidently there are some cases where it didn't. So again, I'm Mr. Bluntness. Mr. Bluntness says have a conversation with your manager about this. It may not even be necessary to grieve or anything about that. You just need to know why you didn't get what you thought you deserved. And if your manager says, well, I think you deserve that because it calls for some more conversation. So please have that conversation. Also, I want to just let you know that there are some changes in the supply chain that begins with some major changes in our warehouse. We've always had a warehouse here, right? Pretty much so. We've had a warehouse here on campus, and we've had one down at the old Lipton Tea building. I mean, if you're a Galvestonian, it'll be the old Target or the old Lipton Tea or the old something forever. That's a major change for us here. You know, it's just a major change. But supply chain is a complicated thing. How many of you use Amazon? Did anybody in here ever order anything from Amazon? Yeah, well, you know, in stores nowadays, you can go to a store, and most of the time it's people say, well, that's not in stock now. We don't have it, but we'll get it for you. And they order it in. Well, the future of healthcare is we don't have everything on a shelf anymore. So we don't have a need for a warehouse anymore. That role was in the past. In the future, we'll be getting everything from a warehouse in Houston or somewhere like that, just-in-time delivery, just like you do for Amazon. You can even order your groceries there now. And most of you are also using Kroger and other places that will bring their bags of groceries to your car. Well, we want people to bring what we need so that we don't have to put our money out and buy it until just in time when we need it. So there's not going to be any warehouses in the future. How did we do this differently than the usual RIF process? I talked about that last time, didn't I? So we're not going to do RIFs the way we used to. Well, the big difference is this is not just a 30-day or 60-day notice. This is a notice that has gone out almost, Vivian, I think 4 or 5 months ahead of time. And the big difference is this affects probably 10 to 20 individuals when all is said and done. It's not a number that is important. Every single individual is important. These individuals, if they have good standing on their HR reviews, will be offered another opportunity to interview for jobs at UTMB. It's even better than that, if you can believe this, and I have to commend HR for the innovation and thoughtfulness. You'll even be able to try out a job. You'll be able to go and see if you like working in that place, if that's a fit for you, something that you want to do. I'm saying this to everybody because I think this is very, very important, that we have a cultural change, that we appreciate people for their contribution at UTMB, and we're just not throwing them out to the wolves. That you're part of a family, and a family takes care of it all. And so Vivian came up with an incredible idea that, look, we're going to have these people go out and interview for jobs that we've identified that have some longevity to them so that they can transfer into them if they want to. I'm sure there are going to be some people who say, well, I don't want to fool with that. I've always done this kind of work and I want to stay here. If that's the case, that's a self-decision. But we're going to talk about options. That may not work for every job at UTMB, but at least we're going to try it for this. Also, we had a visit yesterday from our new boss. Our new boss is Senior Vice Chancellor for Health Affairs, Dr. John Zerwas. And you may have heard that name before because Dr. Zerwas was the Chief Medical Officer at Memorial Hermann, and then he became a state legislator about 16 years ago. And then more recently, he has been the chairman of the House Appropriations Committee, the person who determines how much money and when we get it for all the medical schools in Texas and all of the higher education programs. So Dr. Zerwas spent a better part of yesterday with us, having an opportunity to meet with our deans and our senior and executive vice presidents, an opportunity to review what the priorities are at UTMB and what direction we're going to be going in. So I'm going to take a moment to review some of that with you, but I do want to lead off today by telling you, I know most of you are used to seeing a whole lot of financial sheets up here, and we can keep showing those to you, but I thought it would be a lot easier today, and Sheila persuaded me, just to tell you that we're just slightly ahead of budget. And unless you want to see all those numbers up there for some gratification, I'm not going to show you that. I'm just going to tell you, you've done a great job the first 2 months of this year. We're on target. The things that you have been doing to save costs, and I used an example of that to Dr. Zerwas. Some of you thought we were kind of lost our mind when we said, please conserve water. Well, if you're an environmentalist, that's important. And some of you have yet to tell us that you appreciated us adding in those filling stations around campus to fill your water bottles. But we did that in a self-serving fashion, frankly, not just because we're eco-friendly, which UTMB's always been, but cutting back on the water saved us $1 million. And that's $1 million, can you believe that, from water? Well, it did. So, guess what? Some of those harebrained ideas worked. So, there you are. So we're ahead of budget, probably because of the water, frankly, but there we are. I'll take it where I can get it, okay? Well, has this been a good year for you? I think it's been one of the best years in my life. I don't know about many of you, but you know, I'm living the dream. I hope you're living a dream, or I hope we can figure a way for you to get the dream fulfilled in your life. You know, we opened the Clear Lake Hospital at the first of this year. No easy task, was it, Ann? Not at all. It wasn't. Katrina, you did a fantastic job. I just have to tell you in front of everybody, you are... They need to name 100 hurricanes after you because you're a force of nature. You did a marvelous job and didn't let up. Not only was that sucker opened on time and on budget, but it just passed Joint Commission. It can't get any sweeter than that. Also, Katrina, in that line of thought, you celebrated the fifth anniversary of the Angleton-Danbury Partnership. 5th year. Does it fit? It fits so well that the Angleton Auxiliary has already given the university over $100,000 in scholarship money for students. Again, it's a good fit. Not to mention they have purchased 160 acres of land and want to build a new emergency room, a new office building, and probably in the future a new hospital on their nickel, not ours. So that's also pretty sweet. And you know what that's a result of? That's a result of working together to work those wonders. It's a result of people connecting with each other. And that's what we're best at, guys. What you just saw with the Acosta family and one of our employees and a neonatal team made such an extraordinary difference in one single young man's life. Can you believe that? I mean, he walks, plays ball, does everything, coming out of an incredibly high-risk environment. And you did that. That's something to look back on. How many years? His is 17. Yes, we got reaffirmed as a stroke center, and yes, we got reaffirmed as a neonatal ICU, and yes, we got reaffirmed by Vizient, a true three-peat. Thank you again, Tim Harlan and your entire team, Dr. Sharma. You guys did an incredible job. And we capped off the year with some victories this year in the legislature with a designated formula funding worth a lot of money, $153 million a year for our hospital in particular. And we also got that formula designation extended over to the School of Medicine with more money there. And not to mention the correctional health care program got funded once again very generously to meet our needs there. That's allowing us to expand. And in case you didn't know a piece of trivia, UTMB now owns a prison hospital. It's not TDCJ Hospital anymore. It's UTMB's Hospital Galveston. So just so you know, it's official. They transferred it to us. Along with about 35, 40 years of maintenance that's overdue. No gift comes without some strings. So Tim was especially glad to hear about that, you know. So the most frequent question I'm getting from people is, do you have a plan or are you just winging it? And believe me, if you work in our office, you would know that we don't wing anything. Sheila actually arranged the candy canes out there. So be careful when you take them. They're like those toys that you pick up, you know. They're perfectly arranged. We do have a plan, and we're sticking to it. And I want to go through some of my highlights. Real easy. I'll try not to overburden you with talk today, but best dumb knows I will at the end of the day. 4 pillars that we have guided our decision making in this organization now for, what, Mary, years? How many years? 12 years for sure, that we have been looking at 4 pillars. And the first of those pillars is exactly consistent how we started today. The first is people. We have tried really hard to promote a culture of respect, collaboration, affirmation, and achievement. In short, that means what could happen if we really do work together. We do a real good job in some areas, and in some areas we still have a ways to go, quite frankly, don't we? We got some people who are going this way and other people pulling as hard as they can to go back that way still. The result of that is friction. Think about it. If part of you are moving there and part of you are moving here, there's just a lot of friction in that. It doesn't feel good. It feels uncomfortable. And also, you don't get very far. When people have got their heels dug in so hard, holding on to the way we did it 30 years ago, it just doesn't feel good. You're moving into an area. Believe me, if Joan Richardson can adapt to the technology that's occurred in the newborn intensive care unit, I have known Joan Richardson as long as most anybody in this room. From the day she walked back, literally from California, and started an neonatology program and embraced all the new technology that has gone in saving children's lives. In spite of flooding in the ICU, which is hard to flood. It's on the 3rd, 4th, 5th, or 6th floor every time. But it still manages a pipe to break somewhere and flood. And those little bassinets just fill up with water real quick. You know, even in the most adverse conditions, Joan has found a way of still turning out some of the best outcomes in the world with newborn babies. And she doesn't keep that knowledge to herself. There's generations of young physicians and nurses who have learned that. So much so that there's specialty now in neonatal ICU care for nurses and for physicians. So just one example of many. We have to practice what we teach. We're busy trying to teach everybody else how to do things right. If we're going to do that, we have to be not just culturally sensitive and diverse, we've got to be inclusive. What does that mean? What does inclusive mean? It's not just getting an invitation to come to the party, but included in the fun, the party, being one of many. So we've got to get better at doing that, and not just bragging about our numbers in diversity and this, that, and the other. We have got to take that one step further and be inclusive, that those who are invited to the party and seek to it and actually attend are treated as we would want to be treated ourselves. Did anybody ever tell you that? Maybe your grandma? You know? Mine did. You ought to treat other people the way you would want to be treated. So that means a patient who is in that bed in that emergency room wondering why they've been there 24 hours waiting for a bed in a hospital, they need someone to think, gee, are you hungry yet? You know, gee, do you need some ice and water and all that? And you know what? You're getting really good at that. You're getting awesome. I can actually go out to eat in the community now and have people come to my table and tell me how wonderful care is at UTMB. I don't have to hide under the table anymore. The other day, a person, I've told this story, the staff have heard it too many times, but you know, it's a new group. This lady called me the other day and said, what's that nurse's name at the surgery desk? Yeah, that's a day surgery desk. What's her name? And I said, well, why do you want to know, you know? And she says, oh, she just treated my mama so good, we want to send her flowers. True story. True story. But in years past, I've cringed because I thought they were going to say she was rude or something, you know, because in past times that's been the case. That's not true of the new UTMB. And you are the new UTMB. That's why we are scoring up there so high in patient satisfaction. It's because of you and the training you put in. I've gotten to be a patient here recently, and I can tell you, even the people in nutrition and housekeeping introduce themselves to me and ask me, did I need anything? That's the new UTMB. Another guy asked me, did we hire all new staff, Ann? Because people were so friendly. I said, no, when people are in a new hospital that looks nice and inviting, I think their attitude improves a bit and their ability to help other people. That's my own opinion. It's the same people, and that feeling was there always. They knew why they went into medicine, but the right environment and the right leadership, the treatment from the manager and all is a key thing to making people want to come to work every day. We have to have more than just compassion for those who are marginalized in our society. We have to have and embrace social justice. We've got to stand up for those people who are unable to stand for themselves. We've got to do something about that. And I'll speak a little more to that in just a moment. We have to value our patients, our students, our faculty, and our staff. It's very easy to leave any one of those groups out and forget that they too are customers at UTMB. We have to treat our faculty with respect. So when the students came to me and wrote me a letter and said, we are very concerned about giving up our space in the library for a faculty lounge, we said, let's see on a scale of justice here how that looks. Let's see, there's over that way, there's a 160,000 square foot brand new building for students. And there was no closing down of space in the other buildings here on campus. There was augmentation. Right? Am I getting this right? All right. Janet will keep me on path. So I got Mike Schreiner and Steve LeBlanc to add all that space up for me. And guess what? They netted out not only the 160,000, but another 3,600 square foot of space more than they had at the first of this year. So student space is booming, and in a nice way, I said, our faculty needs a place to go and get away from you. You know, and a little humor, but truthfully, honestly, don't you think your faculty needs a place of escape? Occasionally, do you think their door should be open 24/7 just because yours is? No, they need a place that they can go be faculty. And frankly, we need to honor our faculty just like MD Anderson does. Now, I can't fly in lobster, I'm sorry. You'll have to catch your own and bring it. But I want you to know that we are trying to respect faculty and the kind of things that are important to them and make their lives better. And at the same time, raise and honor and hear our students. You know, it's very unlikely that I'm going to be able to wave a magic wand, or Mike or anybody else in facilities, and cure all the parking problems here overnight. Who comes first in getting parking? Oh, I thought you were going to say the president, Ann. The patients come first. So that's why that big space over there is designated for patients, okay? The rest of us will gladly give up what we need to give up to make it convenient for our patients, okay? And that's the way the world needs to work. It ever irritated you to drive up to a church and there's a reserved place for the pastor, but there's no place for the visitor? Think about that. It's a big signal of what is important, right? So the big signal here is our patients are important, and we're going to give preferential parking to them. And we're going to try to find a solution so that the students' cars don't drown every time it rains and water accumulates on Market. And we'll figure that out, because it's easy as flipping a switch and opening a parking garage gate and saying, drive your cars in here to the top floor and park where you can, and please don't bump anybody. So I think we can work out something that helps. Invest in our workforce is extremely important. Vivian, again, and HR and I have been talking about that. And we want to start that fostering a workforce early on, perhaps in junior high and college, bringing kids on board to work some in the summer. We also want to bring on individuals who are already here who need a lift up in their education by seeking and getting more educational funding through federal and other philanthropic grants. We also want to improve the processes and tools for retention for faculty and staff. I was asked just recently was yesterday, what's happening with our faculty and our turnover rates there? How's it going? Are we keeping people? And my answer is yes, we are keeping people. And the turnover rate is no higher than it is at any other university. People are always going to be seeking a greener pasture. You know that. Some of you went and sought greener pastures, and you're back here. And we're glad you are, frankly, because you come back with better skills and you do more things that you learned at other places. But we're glad that you're finally home and done with your wandering. So we want to keep you here. Talk to me before you leave, okay? We also want to address some other things with you, our employees. And that is your wellness and your resiliency. Because we hear about burnout all the time. Well, how do you keep from getting burned out? Investing in your job is important, but investing in yourself is also important. So you will see some new emphasis going around in our efforts to connect with our people, in healthcare, in all the areas that you can improve your own mental and physical health. We're going to also do that with our students. Dr. Mouton and I have been talking about that, and frankly, our students are overly obsessed with board scores right now. So much so that some of them don't even go to class anymore. They just study for the boards, frankly. And we want medicine to get back to the Oslerian model that so many of you practice, and that is at the bedside, having students see what is most exciting, what really is going on, regardless of your area of medicine, nursing or physical therapy or occupational therapy or whatever. The other value that we really want to focus on is a value itself. Delivering high-quality outcomes that improve education, research, and healthcare delivery is important. And we've seen us able to do that. Bye, Sharon. I know the talk is not going well when your wife gets up and leaves, you know. So there you are. I guess it's over, Sheila. Well, about high-value service, let me just say that high-value service, you've done that 3 times in a row now. That's pretty good. So I'm expecting a 4th. Is it fair to say that, Tim? Expectations? Yeah, well, we're all expecting a 4th in there, but it's up to us to do it, isn't it? We have to help you do that. And many of you started this quest for recognition with Vizient, saying, well, how do I have a part in that? I think by now most of you have found that you have a real dog in this hunt. There's something that you can do as simple as doing what Mike Schreiner does, and that is picking up litter on the campus. You ever watch that guy? He will go a mile to pick up one paper cup and throw it in a garbage can. Little things like that end up in sending a message to everybody. He did it yesterday when we were touring Dr. Zerwas a cover for a plastic straw. He saw it, he picked it up, put it in a garbage can. It can be something that little that transforms a place into looking clean and appropriate, and that translates in people's minds to, it must be an okay place to have surgery. They keep the campus clean. I know you think that's a stretch, but that's the way people think. If they push back the shower curtain and see mold that's been growing there 30 years, they don't want to be in that hospital. At least I wouldn't. We need to provide exceptionally high-value services to patients, students, and employees everywhere they go. Our student health service needs to be immaculate and well-staffed and needs to function well. So does every one of our clinics, all of our clinics, not just the ones here on this campus, and the ones at St. Vincent's House and anywhere else. They ought to be exemplary of who we are because we're there and they reflect us as UTMB. We need to expand our programs to add value to communities we serve in this region. That means we need to be partnering with as many people who put their hand out and say, we want to work with you. You just did a great job of that with the United Way in the SECC. Dr. Resto, stand up. Congratulations on blowing the top off the thermometer again and meeting not just the goal, but exceeding that goal for the SECC. And thanks to all of you who participate in that. The other third pillar, and we're getting through these, we on time, strategic management and growth. We need to pursue the greatest opportunities that help define our future and the future of healthcare both. And how do we do that? We have to strengthen communications that enhance our organizational effectiveness through business intelligence and IT systems. Business intelligence is a big fancy word for saying data. We all rely on a lot of data. The hospital relies on data in the form of a census that tells us how many nurses we need at the end of the day. That has a direct impact on the bottom line of hospital operations. Same is true of our clinics. How are they staffed? Depends, in other words, the cost of them, as how many patients and what the volume is and what kind of patients those are in the process of a week's work or a day. So we have a lot of things to do there that we need rich data that's reliable. And we don't get into a meeting and says, well, my data shows this, and someone else says, well, my data shows this, and it's different. So we have to go back and look at all of those systems and get them straightened out. And that's a long piece of work to get done, but we have undertaken it. We have finished a consultation with experts in that area and are mapping out a pathway. Many of you will be involved in that because it'll go down to all levels of clinical care for the academic enterprise and for all of the areas in management too and finance. We also are going to have to strengthen our ability to grow programs that are partnership with the UTMB brand, which I will mention again in the future, what we'll be doing in the area of pediatrics in the Bay Area. Innovation and improvement, entrepreneurship are all going to be there. I'd certainly like for you to think as faculty members that when you're up to something that's good, other people are going to want it. So be very careful to visit with our legal department about intellectual property rights and things like that on things such as device development, curriculum development, and all of those things. We have experts in those areas on staff that can help you. And the last pillar is resources. What do we do with resources? We need to secure more, and that means through the legislature. It means through philanthropy. it means a whole lot of different ways that we get resources. One of the most common an academic medical center relies on is resources that are generated through the practice of medicine, the practice of nursing, the practice of research that bring money into the university. Those are three common areas that are resources that are traditionally of good value. We have to be a good steward of those resources, and we have to improve at every opportunity how we use those resources. Water is a good example, and there are others. We have to improve the revenue streams that are coming in also. Many of you sitting in this room are people with extraordinary innovative abilities. You've grown up in a world that's rich in IT and IS systems. You know how to use a medical record as opposed to some of us older folks who aren't as quick in that area. I'm looking straight at Rex McCullum. You also know how to manage expenses to increase efficiency without hurting patient care. So there are a lot of things in here that we can all do together. So what is our strategic direction? I knew I'd get to that eventually. I put a compass on that in order to, or someone did, in order to remind me that things go a certain way. Well, first of all, we need to collaborate with local philanthropy, and sometimes they're in very small ways. You know, we're used to thinking here, local philanthropy, $150 million for the Jeannie Seeley Hospital or $100 million for the John Seeley. We think in terms of millions. But you and I know that's not how it works. Sometimes they're little numbers. And those little numbers can be as simple as working with a local school district, working at St. Vincent's House, working with city government, which Becky was just able to do in a new insurance product in several places in Galveston County. And also local community agencies, by our support of them through SECC and by also working with them in their fundraisers, we have a way of keeping and expanding our partnerships. We also need to improve access to health care for the islands underserved especially. And we're looking at that again through some renovations and things like that that would be done jointly with UTMB's help at St. Vincent's House and other places that people seek care as underserved. We need to complete the renovation of the John Seeley Hospital. That's going along really, really well. In that new hospital, you're going to see mental health services, women's health services, children's hospital within a hospital, including PICU. And Dr. Richardson, after many, many, many years, will get a new neonatal intensive care unit in that place to fit those high-risk babies like Alejandro, who was here earlier. So who wouldn't be for that? I don't know. Galveston County, our footprint there needs to be expanded with a closer relationship with the Galveston County Board of Health. Dr. Phil Kaiser, some of you may know. You can stand, Philip, just so people know who the gray-haired guy is. Dr. Kaiser is a health authority. When you see him around campus, be nice, because he's the only person by state law that can quarantine you. And he can do that, and he has done it for a number of reasons. He's also the person who oversaw the investigation of Coastal Health and Wellness's little faux pas with a sterilizers that didn't work and exposed 900 dental patients to potential harm through some contamination. That's the largest investigation, by the way, in an exposure of its type in the entire state of Texas, if not the entire United States. So we need to be working with those people, and it needs to be a satellite for our medical school work. It is, in fact, because Dr. Prem Patel leads one of our SCOPE programs at the Galveston County Health Department's Coastal Health and Wellness Clinic in Texas City, and we're looking for other relationships to do the same thing. We also want to be able to eventually integrate some specialty services over at Coastal. Angleton-Danbury campus has also been a jewel. I've talked about that in the past, so I'm going to skip through that. And our League City campus, just couldn't be going better. We're looking for space, additional space there to put down a bigger footprint for community outreach, for OLLI, for academic space, clinical space, research, clinical trials, rehabilitation expansion, dialysis, and other services. And all of those create an opportunity for us to co-brand. It doesn't have to be UTMB putting out the money for all these. It can be almost anybody putting up an operation in our properties in order for us to co-brand with them. We already have the co-branding with UTMD Anderson, and I know that our faculty have been very concerned that has not been as productive as they would have liked to have seen. Well, there have been some distractions on their end, not so much on ours, in that CMS came down and started some Medicare audits. 65 auditors on their campus full-time, looking at the way patient care and billing and all those things are done. And they're still in the middle of that, drawing to a close. We met with Dr. Pisters, who is the president and CEO of MD Anderson last week. Dr. Mouton was there, Dr. Harlan was there, Becky Korinek was present, and hit the reset button on that relationship in a novel way. We said we want these things done in this specific period of time. And we reached agreement that in that specific period of time, which is weeks, not months, we would address the issue of use of operating room beds, use of inpatient beds in the hospital, survivorship care, that is the care of people who are completing an episode of treatment for cancer, and also in preventive medicine. So we have 4 areas that we are going to be looking at and moving into the future after hitting that reset button. I hope you'll be patient with us as we continue to re-energize that. We had a little bit of discussion yesterday with the Vice Chancellor for Health Affairs on that, and he will be very supportive in getting us across that goal line. The Clear Lake campus is another area that we have a strategic direction for, and I'm sure you know that there will be addition of inpatient pediatric unit with additional ICU beds after last week's visit. I believe, Tim, you increased that by 4. That's correct. And also, we'll be looking at expansion of sick kid care, hopefully to come a pediatric emergency room, additional pediatric specialty care services, and also enhanced cardiology and cardiovascular surgical services at that site in the near future. There are other areas that we are looking at and targeting right now to begin relationships, including Southeast Texas and the Beaumont Orange area, who've lost some critical access hospitals. Our educational programs, I personally hope that we can expand the number of students in the School of Medicine and all of our schools. That would be wonderful. We have an absolutely beautiful space for that. We need the clinical rotation sites, and as soon as our provost office has identified those sites, we'll be moving ahead with filing program requests for expansion. We also are looking at expanding studies in the Graduate School of Biomedical Sciences, upgrading the graduate level programs such as bioinformatics, and also looking at advanced degree programs in schools of nursing and health professions. Enhancing recruitment and retention of faculty is going to be necessary to do all that, and that brings us to our research agenda. In research, we have done some marvelous things this year. The NIH funding at UTMB has gone up $14 million this year alone. That's remarkable in a period of cutbacks at the federal level. So that's good, but it's not the end of the story. There's been growth in National Science Foundation funding. There's been growth from the Department of Defense and all other sectors this year. And we're really, really pleased with that. We were also fortunate this year to get some STAR awards and other prestigious recognition, including membership in academies and membership in the Master Teachers Program. All credits to our faculty. We need to really advance the graduate school's programs. And Dr. Niesel, don't bail out on me here, please. But one of the things that we need to do is address the salaries and scholarships and all for our graduate students. We've got to compete with other people in order to get the best and the brightest here at UTMB. I believe we're well on our way to do that. Well, we do our best to work together to work wonders. With the values of compassion, integrity, respect, diversity, and lifelong learning, you hardly can go wrong. But working together continues to remain the single most important thing to our success. I hope you'll give that some thought. This is corny, but I want you to do it. Look at the person on either side of you. Look at them. And remember, for those of you who haven't got developmentally challenged yet, there's a person on both sides of you, okay? So I noticed a few of you just looking one way. So there's a lesson in that. There's a lesson in that. Now think about it. Joan has two opportunities with a person on either side of her to seek help in a rough situation. So do you. You've got two people, not just one, because there's some shoulder to shoulder. That's an old word we used a long time ago when we were working with the government of Armenia. They didn't say side by side. They said shoulder to shoulder. We go about our work shoulder to shoulder. Because you can lift more shoulder to shoulder. You can get more done. So that's all about working together. Not a moral lesson here, but one that's just common sense. So a few of you don't have anybody on the other side of you. The two of you don't have anybody on either side of you. So in real life, what do you do? You get up and move. And you know, that's what you need to do in the place you work. If you got people that are working side by side with you, you can get a lot done. If you can't, you need to go talk to somebody and move on. You know? Now, hold it. Raimer didn't say leave UTMB. Raimer said that you've got to have a team of people. And if you're not working as a team, you need to get yourself to a place that you can find that team and work together. If you're in it for the patient, if you're in it for what you can get done, do that. What would you like to ask me today? We still have 3-4 minutes. Not that you're on the clock. Okay. Dr. Jeff Temple, is that you?
It is. Thank you, Dr.
Jeff
Raimer.
Temple, on the 18th of this month, will cut a ribbon for UTMB's Center for the Prevention of Violence.
Thank you. Thank you. So this is appropriate to my question. When do we get to remove the ad interim from your title?
I don't know about that. It's something I continue to think about. So I guess thinking time's probably going to be over. So I will probably let them know at some point that if they need me or would like me, I will probably stay around. But if they don't, I won't go away sad. So. Actually, I did a lot of acting in college, so so for me, this is all just an act. Now, I hope you know that I try to be sincere about what I believe in, and I hope I'm connecting with what I think your concerns are in working here. I had an opportunity last night to have dinner with someone who's married to a person who left here under really unfortunate circumstances in a reduction in force. And she's still dealing with that really bad feeling of being ushered off the premises after working here 20 years. So if anything that I can do to change a culture that values the people who work here, I'm going to do that, regardless of where they work and who they are and who their daddy is. Okay? So thank y'all very, very much. Are there other questions? I don't mind. I'll stay all afternoon.
Dr.
So I'm gonna
Raimer?
Go back and ask
Dr. Raimer?
100 emails.
I don't have a
Yes.
question. I don't have a question, but I want to thank you for the bottle filling water stations. They're great. Thank you.
All right. Well, I wish I had something else to throw at you, but I don't. So go back to work.
UTMB Health, working together to work wonders.